How to ease and prevent lower back pain. Do you have issues with your lower back? Are you constantly dealing with shooting pains or sciatica when you stand up from sitting? Are you ready to do something about it? Welcome to the Gymnazo channel. If you want the answer to these questions and want to know more about improving your body, health and fitness, then smash the subscribe button, ding the notification bell and find out more. Let's get into it. Most of us live a sedentary life. This means we spend a lot of time sitting down during work, watching TV, driving, gaming, and just generally relaxing. We are often in a seated position. Even as a PT, when I'm not working or coaching, I tend to be sitting down. Over time, this can lead to pelvic misalignment. Pelvic misalignment refers to a condition where the two halves of the pelvis are not properly aligned or are tilted in different directions. The pelvis is the bony structure located at the base of the spine and serves as the foundation for the lower part of the body. When the pelvis is misaligned, it can cause various problems such as lower back pain, hip pain, knee pain, and even problems with the feet. Pelvic misalignment can occur due to a variety of reasons such as poor posture, muscle imbalances, pregnancy, childbirth, injury, or surgery. Depending on the severity of the misalignment, it may require medical attention or physical therapy to correct it. If left untreated, pelvic misalignment can lead to chronic pain and discomfort and may even affect a person's mobility and overall quality of life. I'm going to tell you 5 things you can do to try and improve your pelvic alignment and hopefully contribute to improve issues with specifically the lower back. The following suggestions will work together to pull the pelvis back into alignment whilst also loosening some of the tighter muscles around the pelvis. Number 1. Strengthen your hamstrings. Number 2. Strengthen your abdominal muscles. Number 3. Stretch your quads. Number 4. Stretch your lower back. And number 5. Practice pelvic tilts. There are several exercises that can help strengthen your hamstrings. Number 1. Deadlifts. Deadlifts are a great exercise for targeting the hamstrings. They can be done using barbells, dumbbells or kettlebells. Number 2. Romanian Deadlifts. This variation of the deadlift specifically targets the hamstrings. Stand with your feet shoulder width apart and your knees slightly bent. Hold a barbell in front of you with an overhand grip and slowly lower the bar towards the ground, keeping your back straight and your knees slightly bent. Return to the starting position and repeat. Number 3. Hamstring Curls. Using a leg curl machine or resistance band, lie face down and curl your legs towards your buttocks. This exercise isolates the hamstrings and helps to build strength. Number 4. Lunges. Lunges are a great compound exercise that work multiple muscle groups, including the hamstrings. Step forward with one foot and bend both knees to lower yourself towards the ground. Push off with your front foot to return to the starting position and repeat. Number 5. Glute Ham Raises. This exercise targets the hamstrings and the glutes. Kneel on a glute ham raise machine and lower your torso towards the ground. Use your hamstrings and glutes to raise your torso back to the starting position. Next, I suggest some exercises that can help strengthen your rectus abdominals, your abs. 1. Crunches. Lie on your back with your knees bent and feet flat on the ground. Place your hands behind your head and lift your shoulders off the ground, exhaling as you do. Inhale as you lower back down to the starting position. 2. Plank. Start in a push-up position with your hands under your shoulders and your body in a straight line. Hold this position for as long as you can, making sure to engage your core. 3. Leg raises. Lie on your back with your hands under your hips and your legs extended straight out. Lift your legs towards the ceiling, keeping them straight and your core engaged. Lower them back down to the starting position. 4. Bicycle crunches. Lie on your back with your knees bent and your hands behind your head. Bring your left elbow towards your right knee as you straighten your left leg. Repeat on the other side, alternating sides. 5. Sit-ups. Lie on your back with your knees bent and your feet flat on the ground. Place your hands behind your head and lift your shoulders off the ground as you sit up. Lower back down to the starting position. Now onto other tighter muscles that could be contributing to the pain in the quadratus lumborum or lower back. The culprit here, tight quads. Here are some ways to stretch your quads. Number 1. Standing quad stretch. Stand with your feet hip width apart, bend your right knee and bring your heel towards your buttocks. Grab your ankle with your right hand and hold the stretch for 20 to 30 seconds. Repeat on the other side. 2. Seated quad stretch. Sit on the ground with your legs extended straight out in front of you. Bend your right knee and bring your heel towards your buttocks. Hold onto your ankle with your right hand and hold the stretch for 20 to 30 seconds. Repeat on the other side. 3. The lunge stretch. Step forward with your right foot and bend your right knee, keeping your left leg straight behind you. Place your hands on your hips and hold the stretch for 20 to 30 seconds. Repeat on the other side. 4. Pigeon pose. Start in a tabletop position on your hands and knees. Bring your right knee towards your right hand and extend your left leg straight back behind you. Lower your torso towards the ground and hold that stretch for 20 to 30 seconds. Repeat on the other side. 5. Wall quad stretch. Stand facing a wall and place your right hand on the wall for support. Bend your right knee and bring your heel towards your buttocks. Grab onto your ankle with your left hand and hold the stretch for around 30 seconds again. Repeat on the other side. Remember to hold each stretch for 20 to 30 seconds. And to avoid bouncing or jerky movements which can cause injury, it's important to stretch regularly and gently to maintain flexibility and prevent injury. As we have discussed, one reason you may be getting lower back pain could be due to tight quadratus lumborum (QL). If your lower back is tight, then sudden movements from this contracted position, such as standing up or twisting the torso, could cause an injury. This is why lower back stretches are the next suggestion on the list. First, you're going to sit on the floor with one of your legs straight out in front of you. Then, hook a resistance band around the bottom of your foot at the heel. Gently bend forward at your hips, bringing your belly down to your thighs. Keep your back straight. Grab the towel to help you bring your belly closer to your legs. Stretch until you feel mild tension in your lower back and the back of your leg. Hold for 10 seconds, rest for 30 seconds, and repeat 3 times. The final suggestion is the pelvic tilt. The pelvic tilt is a simple yet effective way to release tight back muscles and maintain flexibility. To perform the pelvic tilt, lie on your back with your knees bent and feet flat. You can have your arms by your sides and the natural curvature of your spine will lift your lower back slightly off the floor. Gently arch your lower back and push your stomach out, stabilizing your core. Hold for 5 to 10 seconds, then relax. Push your pelvis slightly up towards the ceiling while tightening your abdominal and buttock muscles. In doing so, you should feel your lower back pressing to the floor. Your pelvis should not leave the floor. Hold for 10 seconds, then relax. Start with 10 to 15 reps daily and building up to 25 to 30 reps. With these suggestions, you should begin to feel improvement almost instantly, and regular targeted exercises will alleviate the pain in your lower back. If you made it to the end of the video, thank you so much for watching. Good luck, and don't forget to subscribe for more videos like this. Until next time.